It's time now for our bi-weekly conversation with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Good to see you here, Doctor, this morning. And we're going to really kind of pick up the conversation on where we were last week with the WHO deciding that it's keeping its COVID designation as a global health emergency. Not necessarily all bad news, though, as a key advisory panel has found the pandemic may be nearing an inflection point where higher levels of immunity can lower virus-related deaths. But overall, the WHO Director General warned that in the last 8 weeks, and I know you know this, Dr. Bogoch, at least 170,000 people have died around the world in connection with coronavirus. So how do you interpret this decision? And then how do you kind of square it with the U.S. president's declaration that the COVID emergency will be over on May 11th?
Right. So, yeah, great point. What the WHO did was they basically acknowledged that there's ongoing virus evolution, there's unchecked virus circulation globally, there's fewer member states submitting data and reporting data on COVID-19, including the genetic sequence of virus that's circulating in their country. And, you know, they thought that it was still rather worrisome and decided to keep that technical title of this being a public health emergency of international concern. I think the interesting thing is when you look down the road, 2 months or 4 months, whenever this designation is going to be lifted, is anything going to be different? We'll still have ongoing virus evolution. We'll still have unchecked circulation of the virus. We'll still have member states not sharing their data as well as the WHO would like. So I just wasn't quite sure what they're actually looking for to lift that designation. But it is still important to recognize that COVID is still here. There's still work to be done. It's still disproportionately impacting certain parts of the world that don't have the same degree of access to vaccines or therapeutics. It's still going to disproportionately impact communities here in Canada that are under-vaccinated or are at greater risk for severe infection. And when we look at the U.S., I mean, Joe Biden basically said that in May they're going to lift these restrictions. That's different because that is probably tied to money. I said lift restrictions. What I meant to say is lift that designation. But that's probably tied to money and federal funding for various programs around the country. So that'll be very interesting to see what happens when that designation is actually lifted in the United States, because that might actually translate into, decreased funding for various programs, including surveillance programs or care programs or testing programs or treatment programs. So I think that's a very different ballgame. It'll be very interesting to see what happens as a result of that.
Yeah, I think you're absolutely right. The burden is definitely going to be shifting in the U.S. Come May the 11th. So we'll watch for that and see the impact there. In the meantime, Dr. Bogoch, you and I have talked a lot over the last several years about clear communication and the importance when it came to COVID. And misinformation has been a serious issue throughout this pandemic. And it was just after you joined us on last Thursday that we found out through an independent science research organization some pretty serious numbers. It found that misinformation, as you know, led to at least 2,800 Canadian lives being lost, tens of thousands hospitalizations that could have been prevented, and $300 million in hospital costs that could have been saved. I mean, the headline to me, of course, is the lives that could have been saved. Almost 3,000 lives based on misinformation. In other words, people heard something that was completely wrong, took the wrong approach, and died.
Yeah, misinformation kills. It's awful. Absolutely awful. This has been a huge issue pre-pandemic. Of course, it's been exacerbated throughout the pandemic. And it's terrible. And, it's one thing for you and I to chat about COVID and smart approaches to COVID and how to protect yourself and those around you and public health approaches. But I mean, that's a drop in the bucket when, we're up against well-funded, massive campaigns on social media that span the globe. And we clearly need a coordinated response, not just a Canadian response, but a global response, because misinformation kills. And of course, we obviously have to appreciate and balance freedom of speech, freedom of expression, but of course stamp out overt lies that are circulating, that essentially people see and make unwise decisions as a result of that result in harm. And, personally, and I know many healthcare providers are in the same position, we've seen the impact of that directly. We've cared for patients, for example, in hospital who are really, really sick with COVID, who were unvaccinated, but had the opportunity to get vaccinated and chose not to because of something that they saw online, for example. And that's just awful.
Yeah, and we're kind of out of time here, but I know, Dr. Bogoch, after we finish these segments, in some cases, we get these sort of tweets coming at both of us here, suggesting that, they're hearkening back to the Nuremberg trials and suggesting that people, are basically, put to death for putting out misinformation and suggesting that what we're doing is that. When you're right here, people have chosen their set of facts. We're trying to put the real ones out there, but it is pretty remarkable, the environment that we're living in at this time. Dr. Bogoch, always appreciate the time. Thanks. We'll see you back here on Thursday.
Thank you so much.